I've been practicing addiction medicine for about 12 years, based on my journey and my education and my fellowship training. And this is all I do. I'm not a doc who comes in once or twice a week and checks in and signs charts. This is our facility. We built it, myself and my partner, and I'm here 7 days a week. I see every patient every week. I walk the halls. I do my own groups. I do 4 hours of groups a week. We have a specialized professionals program here where it's healthcare professionals and business executives that I've designed, and they're under my wing, and I do those groups. It's very rare that you see a medical director who's that engaged with everything that goes on in the facility. But this is my passion. I love doing this. I wouldn't do it if I didn't love it. It's been a struggle at times, but to see the results is when we coin out a patient, it's just the most rewarding experience I ever had in my life.
We take an approach that involves the whole dynamics of recovery. Addiction is a biopsychosocial disease, so we deal with all aspects of that disease with a focus on the biological. We incorporate everything I've learned over the many years I've been involved in this disease and treating patients. From the medical, we deal with the cognitive therapy to change brain thinking. And then we take a holistic approach because that's part of wellness. On our staff, we have a chiropractor, an acupuncturist, massage therapist. We do a special type of massage called craniosacral therapy. We do have a biofeedback specialist. That's all part of getting the body in line with the mind. My feeling is whatever works. This is a difficult disease to treat. This is a disease involving the mind, and the mind establishes what the brain does. And we have to change the brain, and the only way to change the brain is to change the mind. Whatever works. So acupuncture works, massage therapy relaxes muscle tissue, it relaxes joints, it has a pleasurable effect. The chiropractor adjusts people. It's not the main focus of our treatment, it's an ancillary. You have to use whatever tool you have in your toolbox. Craniosacral therapy is light touch to stimulate the cerebrospinal fluid as it flows through the body. I never heard of it before, and I had one experience with it, and it was just amazing how invigorating I felt. And she was just touching me very lightly. Apparently it increases the flow of your cerebrospinal fluid, which is the fluid that surrounds your spinal column in your brain. I've heard nothing but positive results from patients. It increases awareness, it increases a sense of wellness, it increases a sense of pleasure. And this is a disease all about pleasure.